For our 13th assignment, we're going to be talking about pandemic diseases. This is kind of what got us into the online situation, a pandemic disease working its way through the United States. And believe it or not, this is not the first one to ever happen. So we're going to make the connection between two of them. Before we get started, we need to define what pandemic is. So open the dictionary. According to Merriam-Webster's, a pandemic is an occurrence in which a disease spreads very quickly and affects a large number of people over a wide area or throughout the world. Pause the recording and put that into a definition in your own words. For your question-focused document, we're going to be looking at this poster that was made by the Topeka Health Service in 1918. Take a look at the poster and generate a question based on it. And now it's time to research the contemporary policy debate. You're going to open the article and you listen or read to it. You're trying to find out what some states, counties, and cities are requiring people to do in response to the pandemic. You need to find out why people support that decision, why people oppose that decision, such as President Trump. Think about what he's unhappy about, and then give me your opinion. After you've listened to the article and answering the questions, you're finished with the first part of this. Our second day's assignment is we're going to be starting our case study. So we are trying to determine what outcomes should policymakers consider when making pandemic disease policies. The consequences of restricting or of not restricting citizens' daily lives. You need to now open the web page and scroll down to the pandemic disease policy case study. This was an official notice made by the Topeka City Health Officer Dr. Clark. Read over the health notice and try and summarize what it would do. The notice reads, because of the experience of cases of epidemic influenza, also known as Spanish influenza in Topeka, all public and private schools, Sunday schools, and churches are hereby ordered closed, and all public gatherings, dances, shows, and entertainments are hereby prohibited until further notice, in order that the spread of the disease may be limited and the health and lives of the citizens of Topeka may be better protected from an epidemic which now seriously threatens. Two words we should talk about real quick. Prohibited. If you prohibit something, you stop it. An epidemic, unlike a pandemic, is just a disease that's sweeping across a country rather than a pandemic, which is spreading across the whole world. The order continues to read, all citizens, firms, and corporations are requested to assist in combating this disease by cooperating in the enforcement of this order. This order shall apply to all gatherings of more than 20 persons, except much as may be considered a military necessity, and shall not apply to Liberty Loan Committee meetings or to gatherings of Red Cross workers for the purpose of preparing material for use by the Army or in combating epidemics. This order shall be effective after 12 o'clock noon of Wednesday, October 9th, and shall continue until further notice. Back on your worksheet, you need to simply tell me what this health officer's official notice would do. After you have summarized Dr. Clark's official notice, we need to talk about our historic context. Tell you that in 1914, World War I started, and a start of a war is going to lead to the mobilization or the movement of soldiers all around the world, including the United States when they joined the war in 1917. As we have all this movement of large numbers of troops, it became very easy for a viral disease to spread rapidly. Historians and virologists, those are people who study diseases, disagree on the origin of what became known as the Spanish influenza, so we're not entirely sure where it began. It could have been China, it could have been here in Kansas at Fort Riley. But anyway, it started to spread rapidly around the world. In the spring of 1918, there was a first wave of the Spanish influenza, which was not too deadly. But the second wave, in the fall of 1918, people who caught it were dying within hours of showing symptoms. As the pandemic swept across America, many states and cities began passing measures to stop the spread of the disease. So why would what was going on in 1918 with the spread of the Spanish influenza, why would Topeka and other cities debate shutting everything down? Answer that. To think about this a little bit more, you all have often said that a job of the government is to protect the people. If a disease is spreading through a community, what should the government do? After you have that, it's time to start section 1, trying to find out why people believe the government should create restrictions. We're going to read a statement by the Secretary of Kansas Board of Health, Dr. S.J. Crumbine. We read this, we need to try and find out why people think government should close things down. He said, "The epidemic is here. We cannot get away from it. So the thing to do is to take the most effective methods of slowing it down. The history of the disease shows that its virulence depends to a considerable extent upon the rapidity of transmission." What he says here, the history of the disease shows that the virulence, this is the severity of it, depends on the extent on the rapidity of transmission. Transmission is how quickly it is spreading from one person to another. He said, "If we keep folks away from crowds, have them take precautions against the disease, we can extend the period of transmission so that disease loses its virulence and becomes only a light cold, and many are not infected who might take the disease. A general closing order is the most effective method of slowing down the disease." After you have highlighted text that you think explains why the government should shut down local businesses, schools, etc., you need to tell me what the quote means, and then tell me why this evidence matters for today's debate over pandemic disease policies. What is it that some people still believe a government should be doing in response to a pandemic disease going through their community? For your visual piece of evidence, you have a few different choices. A number of posters or cartoons that were promoted by different public health agencies in the United States and through some cities. So select one of the cartoons, copy and paste it onto your assignment, and then make sure you summarize the main ideas of the image and tell me why that evidence still matters for today's debate over pandemic policies. We're now going to move on to the third part of the assignment. This is going to be Section 2's evidence, and then comparing the two debates. For Section 2, we need to find out why some people believe the government should not restrict a citizen's daily life in response to pandemic diseases. We're going to read a statement made by American Public Health Association during a meeting of the American Public Health Association made by New York's Health Commissioner, Dr. Royal S. Copeland. We need to look in his speech and try and find out specifically why he's concerned about closing schools. He said, "The most important part of disease control is the public school system. We have 1 million school children in New York, and 700,000 of them come from tenement homes, the poorest homes on earth. It will be better for these children to go to school where the schoolhouses are sanitary and are under the strict regulation than to permit them to linger in the schoolyards or in the basements, etc. It is better for these children to be attending school than to be at home under unpleasant and unhygienic surroundings. If a child showed symptoms or signs which indicated the possibility of influenza, that child was put in a room by himself until examined by a nurse or by a doctor to discover whether he or she had influenza, and a Board of Health doctor or nurse would find out whether the family had a family physician, and if so, whether there was a possibility of isolating and protecting other members of the family. If not, the child was to be placed in a hospital where it could be given care. It is a great deal better to care for children in this way than to turn them loose on the streets to play where they will. How does this statement by Dr. Copeland explain why some people are concerned about the government closing down schools? After you have highlighted and changed the text color of an important phrase in his speech, you need to tell me what the quote means, and then tell me why that evidence matters for today's debate over pandemic diseases. Think about why some people today were still concerned about the closing of schools. For your Section 2 visual, you have two choices. A cartoon made by the Philadelphia Inquirer, ran in the Philadelphia Inquirer, or a cartoon ran by the Los Angeles Times. Two different groups are concerned here. The first one, why are sports fans worried about shutdown orders? Why don't they want the government interfering? The second cartoon, look at the lower right-hand corner. Why would a business such as a movie theater be concerned about shutdown orders? After you've moved it over to the assignment, make sure you summarize the main ideas of the image, and then tell me today, why are certain groups such as sports fans or business owners concerned about government shutdowns? Why do they not want the government to tell theaters or businesses to close or to cancel sporting events? Time for step 2C. Now we need to find out what the result of the debate was and what the consequences were. The state of Kansas and many other states around the United States required schools, restaurants, theaters, etc. to close in order to slow the spread of the Spanish influenza. These decisions were all made by state and local officials. The federal government did not require the quarantining of people, even though they legally had the power to do so. The federal government did pass House Joint Resolution 33, which authorized the spending of $1 million to help fight the spread of the disease. So what we do know is, by and large, policymakers at the state and local level decided to close things down in order to stop the disease from spreading. We now have modern studies that were done trying to identify whether or not these efforts, these shutdowns, were effective. So if we were to look back and compare these non-pharmaceutical interventions, we found out that cities that implemented those interventions, such as shutdowns, had greater delays in reaching peak mortality, lower peak mortality rates, and lower total mortality. So what we can decide, the consequence, what we can conclude, is that places that shut down, such as St. Louis, had far fewer deaths than places that did not early, like Philadelphia. Some researchers believe as many as 50 million people across the world were killed by the Spanish flu, including an estimated 675,000 Americans. You can look at this image here showing a comparison of the deaths happening in different cities. Our compare and contrast here should be pretty simpler. What's the similarity? We're talking about pandemic diseases spreading across the United States and across the globe. What was the name of the disease in the past? What's the name of the disease today? Okay, so for this assignment, I'm not going to require you to do the policy advice, but if you would like to, I'll give you 100 points extra credit. Remember that if you have questions on the assignment, either reach me by phone on the number that I listed or send me an email. Take care, guys. Remember to wash your hands.